Hello, my name is Brian Casey. I'm editor-in-chief of AmpMini.com, and we're here at the 2013 edition of the Radiological Society of North America meeting in Chicago. We're here with Dr. László Tabár. He is with the University of Uppsala in Sweden. Dr. Tabár, thank you for being with us.
Thanks very much, Brian. Thanks.
So, one of the biggest controversies right now in medical imaging is this issue of breast screening, and there have been a number of studies that kind of go back and forth. It seems like every month there's a new one that some say breast screening is effective, some say breast screening isn't effective. Um, what are some of your thoughts on this, and what is it? How are women reacting to it?
You know, Brian, it's not only amazing, but it's actually shocking that people say that there is a controversy, that mammography screening doesn't save life, and so on and so on. I'd like to mention that there is hardly any other diagnostic or therapeutic method in medicine that has been scrutinized to the extent mammography screening was scrutinized. But try to replace the word mammography screening with early detection. Can really somebody who is well trained, a medical person, question the benefit of finding and treating a cancer earlier and as early as we can do with the help of mammography? There is a problem, and I understand, I can explain to you why there is a so-called controversy. It's quite a sad thing that nowhere in the world the cancer registries or the death registries collect data about the so-called detection mode. That is, you go to the SIA data and you find, let's say, 1,000 breast cancer cases, but you cannot find out which one was detected at screening, which one was interval cancer, and which one was detected among those who didn't come. Now, the so-called researchers go to this hodgepodge and they draw the conclusion that mortality didn't go down in a certain time period, let's say 10 years, during screening. You cannot draw the conclusion about the effect or the lack of impact of screening if you don't know whose cancer was screen detected, whose cancer were outside screening. And the biggest problem is that they do these historical comparison, that is, let's say 10 years of screening epoch and 10 years before screening epoch, and then they compare the mortality. I mean, this is such a professional mistake, Brian, that those women who died during the screening epoch, 52% of those actually got the diagnosis before screening. And this is published by New England Journal of Medicine. This is published by JAMA.
Well, one of the amazing things to me is that many of these studies that are anti-screening actually do show a mortality benefit among women who are screened with mammography, but frequently these researchers just say, well, it's due to better therapy, it's due to better treatment, it's not due to the screening. And I sort of feel like, well, how can you just throw that out and just say it's not valid?
Exactly. And as you know, I really like evidence-based medicine, namely in Sweden, after we published our randomized control trial, the half of the country picked up, offered screening, mammography screening for age group 40 to 49, and by chance, the other half didn't. 16 years later, we published the following result. There was a highly significant 29% decrease in mortality in this very sensitive young age group, above and beyond modern treatment. Here is the answer.
Yeah.
So it's really quite childish to say screening or treatment. Aren't we very happy that women whose breast cancer are found early, courtesy mammography, are going to have much better treatment result than those whose cancer is self-detected?
Now, the U.S. Preventive Services Task Force, about a month or so ago, announced that they were going to be opening up their mammography screening guidelines for review. And the USPSTF in 2009 opened a new controversy in the U.S. by saying that they didn't think that by rescinding their guideline that younger women should get screening. Do you have some hope that maybe as part of this review, the USPSTF will go back to its old guidelines that called for screening of younger women in their 40s?
You know, Brian, the professionals were really, really very angry about the task force because anybody using common sense understands that our arch enemy is the advanced cancer. Now, the US task force a few years ago threw out the 40 to 49, did not recommend. Now, what do you think the cancer is going to do? It's going to grow to an advanced stage. So there is nothing more harm to a woman than letting a breast cancer arrive at, grow to an advanced stage. And that's where the US task force actually caused so much harm. They had to realize that many more women are going to develop advanced cancer, also in the 50 plus age group, because they prolonged the length of interscreening interval from 1 year to 2 years. And another year, I mean, the cancer may grow to an undesired stage. So I not only hope, I just hope that they are going to use the farmers' common sense and they come to their senses. This is against women.
Very good. Well, let's hope so. Dr. Tabár, thank you for being with us today.
Thank you.
Signing off for AntMini.com, my name is Brian Casey.